You've probably felt it, that sudden drop in your stomach at the pharmacy checkout. The total flashes on the screen, and what should be a routine errand suddenly feels like a financial shakedown. This experience is driven by a massive, widening gap between what Americans pay for healthcare and what the rest of the world pays. Take a standard asthma inhaler. For an insured American, picking this up can easily cost between $250 and $350 out of pocket. If you take that exact same medication, made by the exact same manufacturer, and hand it to a patient in France, Canada, or the UK, they'll pay the equivalent of the loose change sitting in your car's cup holder. When you run the numbers, Americans are absorbing a 2,000% markup. We are paying an enormous premium simply for the privilege of breathing. That isolated shock at the pharmacy counter perfectly captures the financial trap that defines the entire United States healthcare system. If we pull back from your wallet and look at the national economy, the sheer scale of the money involved is staggering. Economists measure this by tracking healthcare spending as a share of the gross domestic product, or GDP. The United States pours nearly 18% of its entire economic output into healthcare. Meanwhile, peer nations with similar levels of wealth spend roughly half that amount. And for that lower price tag, they manage to provide universal coverage to their entire populations. This double spending doesn't translate to a double-strength system. Despite paying more than any other nation on Earth, the U.S. is falling behind in the most basic measures of national health. You might assume that all this money buys state-of-the-art longevity. Yet among high-income nations, the United States ranks dead last in overall life expectancy. We also fall behind in routine, everyday care. American patients suffer from significantly higher rates of post-operative complications and live with far more chronic conditions than our international peers. With the financial burden passed directly to the patient, nearly a quarter of Americans actively skip doctor visits or walk away without filling their prescriptions. They simply cannot afford the care they technically have access to. The massive national price tag funds an underperforming system that actively discourages citizens from seeking help when they need it most. So if trillions of dollars aren't paying for more doctor visits or producing better health, where exactly is the money draining? It turns out Americans actually go to the doctor less often and spend fewer days in the hospital than citizens of almost any other advanced economy. The cash drains into a tangled web of private insurance, middlemen, and complex coding. To understand this administrative bloat, consider a typical U.S. hospital. 900 patient beds often require 1,300 billing clerks just to process paperwork. Compare that to countries like Japan or Scotland. Their hospitals receive global, lump-sum budgets directly from the government. Because the facility is fully funded up front, there is zero need to wage a per-patient billing war. Ultimately, a massive chunk of American healthcare spending doesn't go toward medicine or medical talent. It merely pays for the bureaucratic friction required to move the money around. These institutional failures eventually land on the kitchen tables of families across the country, where the math of the healthcare system clashes with the reality of living on a budget. For many, that clash is catastrophic. The high cost of staying alive has made medical debt the leading cause of personal bankruptcy in the United States. Citizens relying on the UK's National Health Service or Australia's Medicare certainly face the fear and stress of falling ill, but they never face the threat of losing their homes to pay for a hospital bed. A health crisis in the U.S. often leads directly to a total financial wipeout. It uniquely penalizes its own citizens for the simple misfortune of getting sick. Recognizing the sheer absurdity of how this machine operates is the first step toward fixing it. We can't advocate for meaningful, patient-first reform until we understand exactly what we're paying for. You shouldn't have to choose between your physical health and your life savings. If you want to stay informed on how we can start fighting for a better system, hit subscribe and join the conversation below.